Hello, everyone, and welcome to another Woo University event. It's been a while, so I'm really glad that I could be here for this really exciting topic that I know a lot of you guys are really interested in based off of all your comments from the Woo U surveys. Everyone is so into anything related to eyelashes, eye health, especially with all the products on the market right now that advertise for fuller and more luscious lashes. So we're in for a real treat tonight with Dr. Offerdahl, where we're going to be learning all about fuller, thicker, and bolder lashes. And my name is Dr. Stephanie Woo. I will be your host for the evening, and I am the founder of Woo University. And now it's my pleasure to introduce tonight's speaker. Dr. Offerdahl attended Temple University School of Pharmacy in Philadelphia, Pennsylvania, for her undergrad and graduate degrees. Upon completion of her Doctor of Pharmacy, she completed a residency at Temple University Hospital, where much of her time was spent in internal medicine and infectious disease. She is currently on the faculty at Salus University in the Department of Optometry, and she is the course director and instructor for all systemic pharmacology courses for students in the optometry program. Additionally, she practices as a clinical pharmacist in Rosemont, Pennsylvania. She lectures extensively in the optometry community, and she's a fellow in the American Academy of Optometry. So it's really rare that we get a pharmacist to lecture for Woo U, and I know that the past ones that we've had online, everyone is always so interested because Dr. Offerdahl and the other pharmacists, they just know so much more than us when it comes to pharmacology. And I know that you guys are going to be so excited to hear from her. I know I am. And welcome, Dr. Offerdahl.
Thank you so much. It certainly is my pleasure to be here with everyone tonight. Before we get started, we'll dot all our I's and cross all our T's with COPE. So the only financial disclosure I have for tonight is a non-salaried affiliation agreement with New Skin Pharmanex. And all financial relationships have been mitigated. If you have any questions, afterwards, here's my email address, and, Dr. Woo and her coworkers, that are here at this webinar tonight can certainly share my information with you as well, either my email or my cell phone, and I'd be glad to chat with you. There's so much to know for sure. So some introductory information. When I first started kind of investigating how I wanted to approach this, not only from a CE perspective, but also, a patient information perspective or, other practitioners' perspective. I completely changed what I started with, and what I ended up with. So what I realized is that it's important that we take a couple of minutes to talk about, the federal laws regarding, what is a drug, what is a dietary supplement, how are cosmetics regulated? Everybody's familiar with the prostaglandin issues that we've had with bimatoprost, and we'll talk a little bit about that as a reminder for those who maybe aren't as familiar with it. But what I realized is that the thing that we are seeking as a community, or those that are in the kind of beauty and cosmetic arena as well, is we're looking for a product that's going to do what it says it's, supposed to do, right? It's going to grow thicker, longer, bolder lashes. We want that, of course. That's the whole point. A lot of these are really expensive products, and we want to try to do this with few to no side effects from the products, which is always kind of, makes my brain rattle a little bit, because I walk around saying there's no such thing as, all the good and none of the bad. But that's changing a little bit as we, kind of see the metamorphosis of some of these serum products. So let's go into a little bit of introductory information. We're seeing a lot more research done on human eyelashes. Of course, it's hair, but it's not hair that's the same as scalp hair and other places in the body. We know that lashes are an important component of beauty. So you'll see I have these little lash memes all over the place that I kind of chuckled when I found them. We have lots of different cosmetic and treatments available to enhance the lashes and the brows. I'm mostly going to concentrate, FYI, on the lashes, but the serums that we'll talk about, most of them are also good for the brows, and we'll make some comments there as well. But we know that there are lash perms. I actually had no idea that there were lash perms. They're now called lash lifts. And we'll talk a little bit about that and why they're a little bit, to me, they look a little bit medieval and torturous, and the side effects can be quite profound. Lash extensions. I tried that one time and realized that, you know, my feeling that my corneas were on fire after the fact and during was probably not wise. So that lasted one time. We'll talk about how that works and some side effects with that. False lashes, those have been really big. You know, there are magnetic ones, there are ones that you use glue, all different types. There's lash tints or dyes, and then there are lash serums. Seems like there are so many people that are interested in lash serums because compared to a lot of these other techniques or products, they're a lot better tolerated, and in general, they are. Even if you've never been involved in aesthetics, and I learned, you know, a couple of weeks ago when I was writing my slides, I thought, why do I see E aesthetics and then AE aesthetics? Because one's American English, and of course the fancy one, AE, is the British English. So you'll see whichever one I decided to, you know, to spell the appropriate way in different places. But even if you really are not interested in aesthetics as an optometric practitioner, optometric physician, you know, our patients are starting to demand this. You know, me as a pharmacist, for sure, I get asked all the time, and you folks as well really have the opportunity to educate patients and provide them with a wonderful product for their use. And the greatest thing of all, top secret, is that we don't have to bill insurance for these products. And that, you know, is a wonderful thing. Anytime we can kind of, you know, insurance companies and actually bucks on a product that works well, and, you know, with very few to no side effects, that's a win-win all around for sure. So there's lots of different indications. This is kind of the quick list for patients. We have chemotherapy-induced eyelash loss and, you know, hair. We get brow loss. You get, you know, body hair loss in some cases, and certainly scalp hair. The one thing that I'll say about that is, if a patient is still on chemotherapy where they're using agents that are working on, you know, pretty much immortal cells, you know, the rapidly dividing cells, which are the definition of a cancer or a malignant cell, the lash serums are really not going to be able to do anything because those drugs are working on rapidly dividing cells in the skin, the gut, and the bone marrow. And of course, you know, the lashes are part of, you know, the skin in that regard. Alopecia areata, you can see in the upper right-hand corner, that's an example of alopecia areata, thought to be autoimmune in nature. Hypotrichosis is another type of kind of patchy hair loss. It tends to be on the scalp or anything above the brows, usually present at birth. And, you know, that's a tough thing to treat as well. Trichotillomania is hair pulling. You know, people pull their scalp hair out. They will sometimes pull their eyelashes out, their eyebrows out as well. And once again, if we can stop the practice of doing that, then certainly products and techniques to enhance or, you know, help regrow the lashes and the brows and even the scalp hair can certainly be beneficial. And then just for cosmetic reasons, you know, people love a good lash, you know, as just kind of a mark of beauty. So I've read. So just a little bit of background information, the Food, Drug, and Cosmetic Act of 1938. And of course, you know, Dr. Wu was saying when you get a pharmacist, it's going to be a different kind of presentation than if you have an optometrist or other medical practitioners. You know, we tend to really like to deep dive on the drug details, et cetera. But the foundation of it all are some of the laws that were made to protect us and our patients for sure. So I'm going to read through just a couple of these real quick because I have to paint a picture as to why some of the products that are available are just so terrifying. 1938 Federal Food, Drug, and Cosmetic Act is a set of United States laws that authorize the Food and Drug Administration to oversee and regulate the production, sale, and distribution of food, drugs, medical devices, and cosmetics. Sounds pretty pretty impressive, that the FDA has oversight of over all of those categories: food, drugs, medical devices, and cosmetics. But if you know anything about cosmetics and food and whatever, it's not as deep of a regulation as one would think in some of these categories. So I have misbranded products in bold on that last line. The basic purpose of this is to protect the general public from misbranded or adulterated products. And you're going to see that we have some of this in the cosmetic realm, specifically relating to eyelash serums. A legend drug just means any drug that is requires a prescription to be administered or for a patient to take. So that's going to be, our prostaglandin based products. That's the one we're going to see. Obviously, that's considered a legend drug. And that oversight is very different than something that you can buy in a drugstore, or you go to Ulta or Sephora or whatever. The Federal Food, Drug, and Cosmetic Act also defines cosmetics, anything that's intended to be rubbed, poured, sprinkled, or sprayed, or introduced into or otherwise applied to the human body. And again, the laws are pretty strict governing cosmetics, but there are different ways that people that don't have necessarily the best of intentions, not necessarily in the United States, but all over the world as well, they're not bound by these laws. And internet sales really have a huge impact on this. There was a new modern version of the Food, Drug, and Cosmetic Regulation Act in 2022, but you should understand that this is a little bit terrifying. Any of us can hop on the internet and not necessarily do any research to find out where our product is coming from. That can be from Amazon. It can be, anything. And I'll show you some of the data we have on that. Dietary supplements, just very quickly, because then we will have our three categories. We have our legend drugs, which is going to be the prostaglandin-based products. Then we have our cosmetics. A lot of these lash and brow serums fall into the category of cosmetics. But then we also have dietary supplements, and it's a slightly different category. A dietary supplement is essentially anything that it cannot be branded as curing, preventing, or treating a disease or a condition. That's a big no-no. But it also is anything that's considered to be a vitamin, a mineral, an amino acid, protein shakes, etc. There are lots of different things that fall under this. And even though the Food and Drug Administration in the United States does oversee dietary supplements, I'll show you some information on that as well, just as an example. It's pretty galling when you think about the billions of dollars that people spend on cosmetics and dietary supplements. It's pretty crazy. You might also know, and if not, it might surprise you, or maybe it won't, I don't know. In the United States, compared to many European countries and the rest of the developed world, in the United States, we allow many more banned ingredients, banned in other parts of the world, but not banned in the United States. This is food additives, and it's also cosmetic additives. And if you spend any time looking into that, it really is kind of a terrifying proposition, the different products and dyes and, carcinogenic substances that we allow in our food and in our cosmetics in the United States that in many places in the world are not allowed at all. This just popped up in my email yesterday. So I have two examples that I wanted to show you. One, dietary supplement, because I'm going to tie that into our serums for lash and brow today. That was one of the kind of things that I found interesting in terms of how I changed how I wanted to approach this, because there's so much integration between what we eat, what we do, the dietary supplements and the serum products as well. But look at what this says. It says presence and quantity of botanical ingredients with purported performance enhancing properties in sports supplements. This, just like I said, popped up. It was a JAMA Open Network article. So they were looking at 57 products. 23 of the 57 products, which were just performance enhancing supplements, pre-workout, things like that. 23 out of 57 products, or 40%, did not actually contain any detectable amount of the labeled ingredient that was being advertised for people. Of the products that did contain detectable amounts of the listed ingredients, the actual ingredient ranged anywhere from 0.02% of the advertised amount to 334% of the actual amount. So imagine that a pre-workout maybe has caffeine in it. Can you imagine the range going from, well, nothing, if it doesn't even have any detectable amount in there and you've spent $50 on this jug of powder, or you have anything from 0.02% of the 120 milligrams of caffeine that they were saying was in it, up to 334%. It's crazy. This is allowed because it's just not, it's regulated, but it's not, in the sense that that's dietary supplements. Most companies, if they get caught doing this, they can get in trouble, but the FDA just doesn't have the manpower to oversee all of this. So it happens all the time, It goes from nothing in there to a grotesque amount. And that's why, if you've heard anything regarding dietary supplements and vitamins and minerals, it's not always true that you get what you pay for, but it is true that the research and looking into companies and what they stand for and their studies and, outcome data and their good manufacturing practices, et cetera, they're everything when it comes to dietary supplements. So let's get back into the cosmetic form of this. So we know that eyelashes certainly have a function. They're not there just to make our eyes look prettier. As we try to grow them thicker, bolder, and longer. The lower lid has about 75 to 80 lashes in 3 to 4 rows. Upper lid has about 90 to 160 or 170, depending upon where you read, in 5 to 6 rows. They're considered terminal hair, so they are coarse and more pigmented. And one of the things that I also learned, it made sense, but I guess I'd never really thought about it. One main difference between lash hair and scalp hair, people get gray as they age, or you've heard the phrase, I've probably used this with my kids. They're, young women now, but they still sometimes, I think to myself, you're giving me gray hair. Stop doing that. You're giving me gray hair. I guess I'm lucky because I have light hair, but it can turn white. And we know that stress can have an impact on that. We don't really see that as much with the eyelashes, in people that really get into the late stages of old age. You might see some change in color of the lashes, but not to the same extent that you see with scalp hair. We know that the lashes do form an external and internal, they have external and internal functions, and that they're part of the lid margin anatomy, along with the meibomian glands, the lid skin, biofilm, etc. So it's important just to mention that again, which you all probably know, but it's important to mention it again because they all have a function. Everything has a function. I can't think of anything random in or on the body that just is there because. I'm sure there is something if I really thought long and hard about it, but most of the stuff that we have in and on our body is there because it serves a function. It has a job. So we know our lashes are important for eye health maintenance, and that if any part is inflamed, it triggers an inflammatory cascade, and we can end up with things like dry eye disease. We can end up with meibomian gland dysfunction, et cetera. And we also know that some of the products that we've seen historically and traditionally for lash serum have exacerbated this problem. So it's not really that surprising that we are able to kind of sort through our information and find products that are superior, compared to some of the others. So maintaining ocular surface homeostasis can be impacted by what we do to a patient's eyelashes. So knowing what's in our products and how to recommend them and how to teach people to use them is really the most important part here. Homeostasis is everything, right? I mean, we are made to be self-healing organisms. So when we are using a drug or when we're exposed to something, whether it's on our lashes or on our skin or in our bodies, we are upsetting homeostasis. And that can really cause, anything from a minor set of problems to a major set of problems. And it shouldn't be at all surprising that even something like bimatoprost, that's a prostaglandin analog that people just thought, okay, well, I'm going to, make it into a mascara type bottle or tube, and we're going to start using it on people's lashes. It's not surprising at all that we have ended up in a situation where we have some pretty serious adverse effects associated with that. A couple little key points as well in terms of what lashes are made of. they're comprised of protein. You're going to see that protein, keratin specifically, is one of our really great targets. We have some products that are not targeting keratin. Some are targeting elastin. And while those products may be fairly safe, they don't seem to be as effective as those that are actually augmenting keratin. And that's because the protein that is in most abundant quantity in lashes is keratin. So as the lash hair, just a few more points, we see reduced growth cycles, poor anchoring, brittleness, and breakage. So as hair, they are prone to those problems. Our lash serums seek to augment those 3 points: to improve the growth cycle, which we'll look at briefly, to improve anchoring in the cortex, in the shaft of the lash, and to decrease brittleness and breakage. And that's why I said, as I changed kind of how I approached this over time, you have to look at not just one thing. We have to understand that to have really the most profound impact on lash health and, the length, the fullness, et cetera, we have to approach it from a multifaceted direction. And that's what I was just mentioning, the scalp hair compared to lashes over time. But look at the last 3 little bullets there. It says lashes are not impacted at the same rate as scalp hair or even other body hair. We see melanocyte apoptosis. That's one of the thoughts behind why lashes tend to be less impacted compared to scalp hair. We know oxidative stress can cause gray hair, white hair, because it's impacting the melanin and the melanocytes and expression of certain enzymes. Lashes actually have a very specific enzyme that is in a higher quantity or exists in lashes and doesn't really exist in scalp hair. The jury's kind of still out on that. But look at that middle bullet, oxidative stress. Oxidative stress isn't good for anything or anyone, and impacts something as simple as a hair. So imagine what it's doing, wreaking havoc inside the body. So the eyelash growth cycle is important to mention simply because maybe you have never seen this, maybe you saw briefly. Anagen phase, which lasts about 4 to 10 weeks. This is where a typical eyelash grows about 1 millimeter per week, up to usually a max of about 12 millimeters before it falls out. The anagen growth phase is the active lash growth phase, and that's where our prostaglandin products work. That's where the PGA is there on the right. And then I also have some clover or some plant, picture of a plant there as well that's seen in some of our lash serums. We have the catagen phase, which is the transition phase between the growth phase and the resting phase. And then we have the telogen phase. And suffice it to say that all of the products that are available that have a mechanism that at least on paper looks like it's going to work. And then those that actually do work, they all work in the anagen phase. This is just comparing the eyelash phases and length of time to the hair on the rest of the body. And here they're really referring to the scalp hair. So the eyelash is about 4 to 10 weeks. And that's why most of these products will say you're not going to be able to see any improvement really until 10 or 12 weeks. And while with some of the products that may be true, there are some newer products and ingredients very specific to those products where you can actually start to see an improvement in a couple of weeks or 4 weeks because of how they work and the actual ingredients that the products use. So let's look at some lash options. So here's that lash lift or lash perm. So you can see the top picture. That's actually a patient or a person. They're probably not a patient. They were a client that had the lash lift or the lash perm, as it used to be called. So it uses chemicals like ammonium, as an example, to break down the keratin shaft. I'll be 54, so I remember home permanence or salon permanence, which I never saw the inside of a salon, I don't think, until I was a young woman. But I used to give my little sister home perms, and she always ended up looking like Annie in the musical. It was terrible, but we persisted and we continued to do that. It's the same chemical process in a lash lift or a lash perm, whatever you want to call it. So you're using a product to break down, an alkaline product to break down the keratin shaft very specifically. And then in the top right, you can see that the lashes are kind of slicked back onto this silicone doohickey thingamajig, I don't know what you call it, that goes over the eyebrow, etc. And so the lashes are curled over that. Then sometimes people will actually have a tint as well, which usually includes something like phenylene which is not good, you know, another chemical that we're slapping on our lashes, but you do get absorption, anything that's touching the skin, right? Usually it lasts about 6 to 12 weeks. I've known people that have had lash lifts, you know, that really did like them and tolerated them well. But just like most things, from, you know, riding a bike to cake decorating to fitting people for, you know, lenses and things like that, technique is everything. So in the middle of the slide down here, you can see a lash lift gone wrong. That's a terrible lash lift outcome. But this is an actual picture, you know, something that I found on the internet. Some side effects: ammonium is toxic to the cornea and conjunctiva. So imagine somebody's getting this done every six-ish weeks, or, you know, 12 weeks. Blisters, rash, redness, dry eye, watery eye, brittle lash hair, loss of lash hair. So it just looks terrifying. Eyelash extensions, you can see in the upper right-hand corner, you know, a beautiful set of lashes that are extensions in this young lady. The lash extensions are semi-permanent, that are hand glued on top of your natural lashes. And like I said, I decided, you know, it was, I don't know, maybe 6 months before COVID started, I must have decided that my lashes were insufficient for my taste. So I decided to do the lash extensions. And like I said, I remember sitting there when the glue came out and I felt like I couldn't even catch my breath, much less open my eyes or blink my eyes, because my cornea was scorched. I thought, well, this can't be good. This cannot be good. And so that was the first and only time I did that. But if you look at some of the glues, butyl cyanoacrylate, octyl cyanoacrylate, or formaldehyde. Formaldehyde is probably the really cheap glue that some places will use. So, you know, the general recommendation for people who have lash extensions is to find a place, obviously, that has really good reviews, and those that are not using the formaldehyde-based product. But that is just crazy to me. Side effects, and I have some whopper pictures for you. Traction alopecia. You know, which just due to the weight of the lash extensions themselves, you know, that can cause your natural lashes to fall out. Allergic reaction, damage to lashes, but get a load of some of these. Oh my gosh. So this poor young lady had a, you know, a chemical reaction to or reaction to the chemicals. I mean, she said that she looked like she had zombie eyes, and I would tend to agree. And the saddest part about this particular young lady is that, and I have, you know, the links where I got some of these stories. This one was from New York Post, but they thought, or she thought, that the first set of extensions, it wasn't done correctly. So she went to a different place, like within a few days of the first set of extensions, had them taken off with glue remover, and then a new set of extensions. And that exacerbated the problem even more. This is the same young lady. You can see all the yellow, you know, purulent discharge and whatnot. And this is another picture. You see these all over the internet, and there are, you know, research articles and whatnot talking about this, but you can see this is lash extensions gone wrong. That is a shame, and that is terrifying. But there's hope. In the bottom left picture, in the quartet up there, you see some little baby hairs. Slap some good serum on there and get those suckers growing. So yeah, I think this qualified as a holy crap moment. So Prostaglandins. Let's talk just briefly about prostaglandins so we're all reminded as to why it is not at all surprising that they work. And it's equally not at all surprising that they have, quite an impressive list of side effects, anything from sort of mild to pretty darn awful. So we know that endogenously we have prostaglandins in many different places in the body because these, help our body understand that something is wrong. So, when we have, if somebody falls asleep during this lecture and they fall face first and crack their face on their keyboard or on their kitchen table, wherever they are, you're going to think, ouch, that's smarts. And your body's going to, increase the amount of prostaglandin because some of it is inducible. And that amount of prostaglandin is going to tell you, oh gosh, you may have a head injury. Should we get that checked out? Maybe, it's something bad. We need to know that. So that's what prostaglandins do. They are increasing the inflammatory mediators. Normal inflammatory process, in our body. And like I already said, it's our body's way of protecting itself from further damage. So certainly our prostaglandins have lots of jobs. I mean, think about prostaglandins. They also make platelets aggregate, which is why in people who have had a myocardial infarction or an ischemic stroke, that's why we use low dose aspirin to decrease prostaglandins, to decrease platelet aggregation. So pretty slick, right? We also have prostaglandins, that are keeping the integrity of the mucosal lining from mouth to anus, kind of that nice, thick, plush mucosal lining that comes from prostaglandins, which, going back to aspirin, if you take aspirin, its number one side effect is erosion of the gastrointestinal tract, anywhere from mouth to anus. So prostaglandins have a job. It is nice because when we have prostaglandins, they are pretty much affecting only cells that are close by to wherever those prostaglandins are being induced or where they currently exist. But we do know that excessive amounts of prolonged prostaglandin levels that are at higher than, kind of the homeostatic level that we actually need, that's where we get pain, inflammation. That's where we see people long-term, ending up with that subterranean inflammation and oxidative stress with autoimmune disease, et cetera. So keep this in mind. I'm just sort of painting a picture as to why high prostaglandin levels, higher than what our body actually needs at that particular time, endogenously or exogenously with our prostaglandins, it's going to create a problem. So over on the right, you see exogenous prostaglandins in or on the eye. The body's not fooled. I always say that, we're pretty sexy beasts, that's how we're made. I already said, made to be self-healing organisms. Our bodies know when an imposter is being thrown into the mix, something like bimatoprost in this particular case, it's not going to say, I wonder if this is just prostaglandin from the inside that somehow made it outside and is now sitting on my lashes or in my eye, on the anterior surface of the eye. It doesn't work that way. It immediately hits that threat level midnight button where it, is going boop, 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 drugs, bad, get out. So not only that, but we're adding an exogenous chemical, bimatoprost in particular, that also is increasing prostaglandins. Now we know it's a great drug to lower intraocular pressure. It's fantastic by itself or used with other agents to lower intraocular pressure. But we learned very quickly that, some people using the ocular topical product of bimatoprost and others saw meibomian gland dysfunction, dry eye disease. We saw and do see darkening of the iris, particularly in hazel eyes, that they can permanently change the color of the iris to dark brown. And it has to do, very specifically with the number of melanocytes that are in there. So we don't see it so much with lighter eyes because there are fewer melanin containing cells, the melanocytes. And we saw an improvement in lashes for sure. I remember a couple patients came in years ago when it first came out, and they were like, "Look, I have a little eyeball beard right here," because the bimatoprost would run out of the corners of their eyes, and they were like, "Look, I'm growing a little eyeball beard," on the inside corner of the eye or the outside. So it's not at all surprising that somebody thought, "Let's make a lash serum." Lengthen lashes, darkens the lashes, but we also see some pretty awful things. Periorbital fat loss, darkening of the lid skin, redness and swelling in and around the eye. It can be pretty awful. Prostaglandins work on the anagen phase in the growth cycle of lashes. And, this well-known product, it is brand and generic, and this well-known prostaglandin product, it's not at all surprising that you would see 106% fuller lashes, 25% longer, 18% darker. People had great results with this product, but you got to keep in mind, you can't ever have the good without the bad when it is a drug. There's no such thing. The side effects might be minor enough that maybe the patient doesn't realize it, but it doesn't exist. It doesn't exist. So if we sort of, compare brand and generic for these products, you folks know more than probably any other category of prescribers that brand and generic are not as identical as everybody really wants to think that they are, particularly, because you've got the solution suspensions, the emulsions, the gels, et cetera, and, some of the preservatives as well. It gets kind of crazy. But anyhow, I loved this little meme here. I like my eyelashes as black as my soul and as long as the list of people I hate. But you can see, in this particular set of photos, that you see some of the side effects that are just well known and a systemic issue with the prostaglandins. So the lady at the top, she was just a monocular IOP lowering with the brimatoprost, and you can see how she has some of the changes from the prostaglandins there as well. Back to internet sales, there was a small study that looked at prostaglandin analogs and eyelash serums that were purchased from Japan. So again, we're looking at the ease of being able to buy anything you want from any place in the world, good, bad, ugly, and everything in between. So these were all internet purchases, 64 serums from 34 websites. The results, 4 of the 64 products did contain the prostaglandin brimatoprost. 3 of the 4 did not have brimatoprost listed as an ingredient. Terrifying. 8 of the 64 contained other prostaglandins, and we'll talk about what those were likely. The synthetic prostaglandins that we see in some of the lash serums, for which there have been multi-million-dollar lawsuits, et cetera. But we need to do better for our patients. Even if we are not interested in these aesthetic products, we need to know what to recommend for our patients because they're going to ask you. So, in essence, we need to make sure that we are providing the best environment to optimize growth for lashes. And it's much simpler than you could have ever imagined. Don't forget about our synthetic prostaglandins, which are contained in a good number of the serums that are available. They have to be listed in the United States, but again, if you get them off the internet, not necessarily going to see that, listed. So we have our synthetic prostaglandins, the isopropyl cloprostinate, the isopropanol phenyl hydroxypentene, dihydroxycyclopentyl heptanate, et cetera, et cetera. So I did a deep dive on Reddit all over the place, and people were just, floored that they could get a lash serum at, one of the big name stores that would have a prostaglandin, and it doesn't say it on the package. All of these, that have this, also one of these synthetic prostaglandins also have, conditioning and boosting products like biotin, panthenol, sodium hyaluronate, et cetera. So they were mixed with other things, but still that synthetic prostaglandin. There was a $38 million settlement that had been reached in 3 class action lawsuits against a big name manufacturer just for this reason. And, that's what we worry about, misbranded drugs. And that's, even though it wasn't prescription, it was a cosmetic product. It was essentially listed as kind of a misbranded drug. And these are just, again, pictures of, an eye for a young lady that was using a product that contained a synthetic prostaglandin. Even the little chihuahua likes his lashes. Mechanisms matter. You know, what's driving the improvement? Things are not random. Something doesn't work just because, you know, there is something that's either going to make it work well, not make it work at all, and also drive the side effects. You know, our first medicines come from plants. We all know that. You know, there's a huge movement, particularly after COVID, you know, for functional medicine. I mean, it's been around forever, but there's a bigger push because people understand that, oh my gosh, I don't have anything that can fix this as it pertained to COVID. But a lot of people want the quick fix. A lot of people want the drug. I mean, that's what keeps me in business, right? I can't tell you how many people are like, no, thank you, I'll just take the drug. That's just what they do. And then it's the same with supplements as well. You know, dietary supplements, good supplements work, but it's all about what is in there, what the ingredients can do, where they came from. And maybe even with the lashes, just like every other place and system in the body, thinking about those reactive oxygen species. So, you know, we can start to think functional medicine for lashes and brows. Couldn't be better than that. So the good guys, products containing polypeptides. What do polypeptides do for lashes? So we should be looking for a product that contains polypeptides as one of the ingredients. They stimulate eyelash growth because they stimulate keratin production, which we already mentioned was a key structural protein of hair. They can also help deliver key ingredients. So all the different things that we're looking for, I'll mention them here and then I don't have to do it again. We want something, or, you know, polypeptides or more than one ingredient that can improve anchoring of lash in the follicle, improve eyelash length, improve eyelash diameter, strengthen the eyelashes. These are some of the most common polypeptides that are available in products. Myristoyl pentapeptide, myristoyl octapeptide, etc. So those are the good guys for sure. The polypeptides are also working in the anagen phase. There are some products that just try to cash in on the polypeptides, which, you know, it's a great ingredient, but it's part of what we need for sure. So polypeptides are one of the good guides for sure. Then we have some, miscellaneous ingredients. There are some lash serums that really try to focus on, well, let's do the oil, sunflower oil, castor oil, argan oil, coconut oil. Oil's great. It conditions, etc. You know, just like with our hair and our skin. But again, it's only part of the puzzle of ingredients that we need to really cash in on the mechanism for improving lashes, thicker, longer, bolder. Biotin, panthenol, selenium, arginine, all different types. Works on the anagen phase as well. But what we look at in terms of our plant ingredients are those that really have the ability to kind of power the mechanism. Really not much different than looking at our plant-based products that can work against reactive oxygen species systemically. The difference here is that when we use a lash serum, we don't have to worry about our dietary supplements, our plant-based ingredients, et cetera, crossing the blood-brain barrier in a high enough amount to actually improve lashes, which can occur, but we can have the best of both worlds, rather, and do both. Biotin oil, tripeptide, red clover and peptide blend, myristoyl pentapeptide, etc. We've got lots of great plant-based products that will help patients see an improvement and clients see an improvement in their lashes. So can we have it all? I found this, I loved it. It was on a Vogue, Vogue.com spot, and essentially it was an article, and they were listing all the different best lash serums, lash and brow in some cases. The plastic surgeon developed this particular product was $150 for a 1-month supply. The peptide powered, $55 for a 1-month supply. The targeted application, $48. The preservative free, $52. The mascara hybrid, $45, all for 1-month supply. The biotin infused, I guess biotin, you know, adds some cost to the mix. So we were up to $90. The vitamin E enriched, the new arrival, $150 for a 1-month supply. And all of those are great individually, but what if we found a product that could put all those together for our clients and for our patients? You know, can we have it all, efficacy and safety? And I'm here to tell you, yeah, you know, that the product does exist. Plant-based, prostaglandin free, BAK free, fragrance free, oil free. So it's okay to use in people who have lash extensions, phthalate free, paraben free, silicone free, alcohol free, product that can be used safely in contact lens wearers, $79 for a 3-month supply. So you can find dozens and dozens of different lash serums. And while many of them have a solid set of ingredients, many of them are just narrow. You need more than one, more than two, more than four to really create a scenario where you're going to have the best result in a patient's lash and brows. So I got to thinking, in true pharmacology form, when you think of, alcohol and aspirin, additive effect takes place when two drugs are given together and double the effect is produced. So, alcohol plus aspirin, not a good combination, but certainly, a patient's going to feel better. So if they're in pain, they're going to go from the red side of pain down to the green because the alcohol plus the aspirin, while it actually mitigates some of their pain, the side effects can be just profound. And that's why down here on the bottom left, you see the good and the bad. It's constantly pulling when we talk about drugs. And then in the middle, food is fuel. We know that about the body, right? And, having a really well-balanced diet with all the little nitty-gritty and different components, all the different colors of the rainbow, that's how we're going to have the strongest and healthiest bodies. It would be a little short-sighted if the only thing we had a patient eat was just spinach, green spinach. That was it. No other colors of the rainbow. They'd probably be healthier than without the spinach, but we need every little component to make it the best set of ingredients possible to strengthen the body. It's really no different with our lash serum. And all the different little components that we see in lash serum, the polypeptides and the different plant-based ingredients, and no oil, no fragrance, no alcohol, no BAK. We can use the same type of thinking for our lash serum to create a situation where we have the best outcome. We have products with special cameras. Actually, a lot of the serum products that I looked at actually had this kind of special camera, but this was a baseline picture of the left eye and the right eye. So kind of keep an eye on the green lashes here. This is at week 4 after a patient started on this new lash serum. So this is the pink in the left eye and the right eye. And this is where you superimpose one on the other. So you can see at week 4, just at week 4, and most of the products, except for a couple, will say, oh, you can't see any difference at week 4. Well, I'm here to show you, that you can. You can see the pink improvement there with lash length and density for sure. We can look at these results. My lashes are conditioned and protected. My lashes look thicker and more voluminous. My lashes look revitalized, etc. My lashes appear healthier. The length looks longer. The lashes are defined and separated. It coats my lashes evenly and my lashes look more youthful. So we can get all of this with products that are available now without the awful side effects, that we're going to see in patients. Again, these are just some of the side effects that we see with the prostaglandin based, that's certainly an extreme one on the upper left, but that injected eye, the red conjunctiva, and then you can see some styes on the bottom as well. You can have the good without the bad in 2023. And while I was not somebody who was initially like, yay, a lash serum, I was pleasantly surprised. And, I was unenthusiastic because I had used so many different products, non-prostaglandin based, but many products, and spent a lot of money on the products really to have not a great outcome. And, that's changed now with the products that we'll talk about in the breakout room tonight.